Hi, I'm Liz Cortez with Business Trends TV, and on today's show, I am here with Dr. Jennings from Health Summit Chiropractic. Are you here?
I am. I'm here.
Yay, excellent. Well, thank you so much for jumping on our show today. I want to jump straight into some of our viewers' questions, and the first one is, when they are going online and they are looking for, someone to help them with their autoimmune disease like Hashimoto's or hypothyroidism, what advice would you give to them when they go online and they see all these doctors that want to help them out?
Well, first of all, it's important to know what Hashimoto's thyroiditis is and what hypothyroidism is. So you can ask the doctors the right questions. So hypothyroidism simply means that there's one of three things happening. Either the thyroid is underproducing thyroid hormone, or those hormones are not being converted effectively, or third, the hormones are not reaching the cells. Now, Hashimoto's thyroiditis is an additional diagnosis on top of hypothyroidism, which indicates that there's usually an autoimmune condition driving that hypothyroidism. So when you're going online, you want to find somebody who understands the difference and who understands that the autoimmune piece is a significant factor. So I would look for and even interview doctors and ask them, what kind of testing do you do? Are they only testing for TSH, T3, T4, or are they doing a more extensive thyroid panel? I would ask them, do they look for autoimmune antibodies? Are they testing for autoantibodies? And if so, what do they do if those are positive? To me, that makes a big difference. But there are too many doctors out there who don't test because it doesn't change the way they would treat that patient. So the chances are, if somebody's not looking for it, they don't know what to do about it.
Great. Thank you so much for sharing that with us. And oh man, that will make a huge difference. You got to find the right doctors that will run and do the right test, and
Yeah.
make sure to take those steps versus just going straight into treatment. So I know that you shared with me a little bit about your story and how you have, had great success with your autoimmune thyroid disorder for 17 years. So I would love for you to share with us a little bit about your story.
All right, thank you. It's true. In 1998, when I was 28 years old, I was a classical pianist and had two little kids at home, and I became very, very sick. And I didn't understand the symptoms, not being in the healthcare world at all. And I let the symptoms go too long, and they became very severe, and my condition became life-threatening. So I had symptoms like hair loss. I lost more than half of my hair, and it was really scary. I had a chronic cough that wouldn't stop and was very disruptive. Every time I spoke, I would cough. I had a tremor. I had restless leg syndrome. I couldn't sleep. But the worst was that I had profound fatigue. I could really barely function. I could barely care for my two little kids. I literally would walk my son to kindergarten, 3 blocks away, come back and collapse, and lay on the couch until it was time to pick him up and go back and do it again, and I was spent. That's all I could do pretty much the whole day. And finally went to a doctor, and an endocrinologist diagnosed me with an autoimmune hyperthyroid condition and told me there was no cure. And his suggestions or his treatment plan were two pretty extreme measures, one being surgery to remove my thyroid, the other being radioactive iodine to destroy my thyroid. And being a 28-year-old, those both seemed really severe and extreme, and I knew that both of them would leave me dependent on thyroid replacement hormones the rest of my life just to stay alive. And I knew that meant I would never truly be healthy again. And wanting to be healthy, I found a chiropractor and kinesiologist who helped me identify the triggers to my autoimmune condition and help me restore my health. So within 6 months of seeing this doctor, all of my symptoms were gone, and all of my blood work was normal, and I actually felt better than I had in a long, long time, like at least 10 years. And so that experience taught me that if if we just give our bodies the right tools to heal, we can. And if we can identify the triggers to an autoimmune condition and remove those things, we can live a very healthy and joyful life. And I've been able to do just that, drug-free, for the last 17 years.
Wow, that is a fabulous story. Thank you so much for sharing that with us. I mean, it is awesome, that you used this experience to really, get into this industry, this health industry, so that you could really support and empower people with similar or, different autoimmune disorders and help them have success without having to use drugs and without having to remove a thyroid or, doing some of those normal procedures that people do all the time. You learned
Right.
how to do it in a different way, which is so much healthier. So, oh, that is so cool. Now, I know that, people are going online and, they may be looking at checking out doctors in their area. What advice would you give them when they go online, when there's like, reviews or, there's so much information online? How do they choose the right doctor? You shared with us a little bit more, but I would like you to share a bit more about that area.
Right. Well, I think it's important to find out how much experience does this doctor have dealing with thyroid conditions. Do they have success? Uh, to me, it makes a huge difference that I have personal experience because I've been through all of these symptoms and I've learned what it takes to heal them and overcome them. And so looking for somebody who really has the experience and who's done specialized studying in the endocrine system, specifically about thyroid disorders. And you've got to look for doctors who are doing the right testing. That's where a lot of things fall short, is inadequate testing. And if you're only testing to find out one connection, there are 10 more that are where there's a possible dysfunction going on. So complete testing, understanding the difference between a thyroid condition and an autoimmune thyroid condition is very important as well. If the doctor's not looking for autoimmune, then that probably means he can't get somebody well because he doesn't know what to do about it, or she.
That's excellent. Cool. And so I would love to know, if someone was coming to you, to empower them around their autoimmune disorder, what type of experience would they get, working with you and your team?
Well, they would get all of my experience, many years of experience living this journey and this pathway successfully. Too many thyroid symptoms and problems are being allowed to continue year after year, simply because the patient is not given the right tools for their body to heal, and they don't have a doctor who can help them identify their triggers and detoxify them effectively. So if someone were coming to see me, they first of all get many years of experience and a lot of understanding and empathy. I know what it feels like to be really sick, and I know what it feels like to totally regain my health, and I value that so much, and it's what drove me to become a doctor. So it wasn't an easy thing to pick up my little kids and go to chiropractic school, but I did it, and now I get so much joy from helping other people regain their life, not just with thyroid conditions, but that's, obviously that's one that's near and dear to my heart. So coming here, we are a very personal and warm office. I have a staff with me who have the same passion. We really are like a family, and we really embrace all of our patients. And I think if you spoke to any of my patients, they would agree that they feel like they're part of our little family here. So a lot of experience, the right kind of testing, customized plans, and joining our little family community here with a lot of support all along the way.
That was excellent. And not only, is there the family, the local family out in Colorado, but you also work with people in other states, in other areas. And so that was something really cool that you shared with me the other day, is that they don't have to be there local. You also work with people online through using this awesome technology like what we're doing right now, right?
Exactly. I do a lot of, I have a lot of patients that I work with out of state. Local is great. I love to see you face to face, but if that's not possible, I do Skype appointments. I do a lot of phone consults. We can do a lot of blood work and lab testing, and certainly customized nutrition and detoxification plans. So I can absolutely help people whether you're near or far.
Excellent. So just one more thing to go over today, and I know that you have something very special for the viewers that are watching this right now, so why don't you tell us more about that?
I do. I have accumulated a lot of knowledge and understanding about thyroid conditions. So for people who are watching this, if you want to click on the link below, I would love to send you a report I've written up with just more information. So to help you understand your thyroid condition, what kind of testing you want to look for, and the things that I do to help people regain their health. And that would be absolutely free. So I would invite you to take advantage of that.
Excellent. And I'm going to let you guys know exactly where you want to go. So it is right here. So you're going to want to go to www.healthsummitchiro.com/thyroid to get that free report. Or you can just click the link below like Dr. Jennings just said. So I just want to thank you so much, for doing this interview with us today. I know that you've made a huge difference for the viewers that are watching this right now, and this was a whole lot of fun. So thank you.
Thank you so much. Happy to do this.